have Suzanne McClain, who is our Medicare expert. I shouldn't say us. She has her own company. She's been doing this for many, many years for my clients, all of which absolutely love her. So I hope you guys get a lot of good information out of this presentation tonight. Obviously, this time period during open enrollment can be very confusing for a lot of you when it comes to Medicare in general, Medicare changes, and understanding these various plans. Suzanne only does this. This is all she does is Medicare plans. So she knows this stuff absolutely inside and out and can help answer your questions. For tonight, we're going to go through an entire agenda where Suzanne's going to present for about 40 minutes, various slides, so that you have not only a good understanding of Medicare, but can also ask some questions at the very end. So you see here on the agenda, we're going to go through some basics at the very beginning, and then we're going to talk about things like IRMA, which I know a lot of you have questions about. We're going to talk about how Medicare relates to your public pension. So for those of you that have STRS, OPERS, OPNF, we'll talk about how Medicare really ties in with the systems. We're also going to talk about if you're not in those systems and how it works, okay? And then of course, at the very end, Suzanne's going to take questions, as many as you guys can throw at her. If it's a very personal question, then we'll probably take that offline, where you could contact her directly or obviously reach out to my team and we'll get you where you need to be in order to get that question answered. But hopefully for tonight's sake, Suzanne will present and be able to answer any of these questions that you may have. So without further ado, I'm going to stop my share, and Suzanne's going to take over. Just a couple housekeeping items though, before we get started. So we ask that you hold all of your questions to the very end, okay? So it'll be hard for Suzanne to get through everything if we have questions from everybody throughout the presentation. The other thing is you have a chat box at the bottom of your screen. You can go ahead and ask us questions throughout the presentation, and then we're going to keep that list. And then when Suzanne's done with her presentation, we'll go ahead and get those questions asked, okay? We are recording tonight's session, just so you know. That way, anybody that wasn't able to make it tonight, or if you wanted a replay of it, we can get that to you. So without further ado, I'm going to turn it over to Suzanne.
Thank you, Todd. I'm going to go ahead and share my screen with you real quick. Then you'll be able to see what I see. All right. All right. Okay, can everybody see here where it says navigating the Medicare maze? Perfect, perfect. So basically, when I look at Medicare, I like to look at ourselves as kind of the guide to get you through the Medicare maze, because as many people have told me, it seems like it's a maze. And what we have found is there's multiple ways outside of that maze. So there's not necessarily a cookie cutter, like this is the best thing for each person. What we like to do is take into consideration your unique situation and say which path through the maze makes sense. So what we're going to do is just kind of go through the different parts of the Medicare process. So, all right, so what we're going to do is, let's see here. Anybody that's on the call here tonight, I'm totally fine sending you a copy of my book, Navigating the Medicare Maze. And basically what that book is, it's really what I did is I combined a lot of my client stories, and we created a book that will help anybody turning 65, retiring, just kind of give them the basics. I call it layman's terms of the Medicare. So anybody would like to get that book, we can send it to you. Now, we do have some disclaimers that we have to go over. The first one is, and I have to read this verbatim from Medicare regarding Medicare guideline. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact medicare.gov or 1-800-Medicare to get information on all those plans. Now that's a Medicare disclosure. I had to read it word for word. Okay, so here's just another disclaimer saying that we are not part of the federal government. We are independent insurance agents that that were contracted through the insurance carriers to sell or enroll in Medicare products. So a lot of times I get calls and people will say, well, I'm turning 65. What do I really need to do? Because they start talking to their friends and they're like, well, do I sign up for just Part A? Do I sign up for Part A and B? Do I need to stay on my employer plan? If I'm still going to work, or maybe I'm on my wife's plan. So there's lots of different scenarios that each person, takes into play. And what we'll do is we'll cover most of those scenarios here for you. So one thing is we're getting ready to go into what Medicare calls open enrollment. Now, October the 15th through December the 7th is when, if you're already on Medicare and have a Medicare plan, this is the time of the year that you're able to shop those plans, not all plans, but some plans, to see if it's the right plan for you for next year. If you want to make a prescription drug change from one company to another, this is the time of the year. Or if you're on a Medicare Advantage, this is the time of the year. So you'll probably start seeing a lot of TV commercials, trying to get you to call to make plan changes, a lot of phone calls, just a lot of talk because we're right in this period. So I wanted to give you an idea here. Now, if you've paid into Social Security, so you're not a public employee, so you don't have the PERS or OPERS, we can help you work through the Medicare maze, so to speak. If you are a PERS or OPERS retiree, then the way that it works is depending on the years of service that you have, depends on if you're eligible for a reimbursement or a healthcare stipend or reimbursement. And if you're under that situation, then what you have to do is you have to go through a company called VIA, it's VEI, benefits in order for you to receive that stipend. And we'll talk a little bit more about that here in a second.
And that's also STRS and OPNF people to keep in mind. Okay.
How do I enroll in Medicare? So if you're not drawing Social Security, and you're going to enroll in Medicare, you really have two choices. You either can go to your local Social Security office, or you can go online and apply for Medicare online. If you are drawing Social Security, because some people take it, at 62 or early, if you're currently drawing Social Security, then the way that it will work is you will be automatically enrolled into Medicare Part A, Part B, and you will receive your Medicare card in the mail about 3 months before you turn 65. Now, remember, if you're drawing Social Security, let's say your birthday is January the 25th, your Medicare would start the first day of the month you turn 65. So it would start January the 1st. So your card will come to you automatically if you're drawing Social Security about 3 months before. Make sure you watch for it to come because, of course, with you turning 65, basically the way that it works is you're getting tons of junk mail. So be careful. So the question is, once again, what do I need to do if I'm still working at 65 years old? Well, I always tell clients we need to still talk. We need to have a conversation so we can dig up information as to what size is your employer plan? Do you work for maybe like a small dental office that has maybe 15 employees? Or do you work for a hospital system that maybe has 3,000 employees? Because it really makes a difference on what size of employer plan that you have access to if you're still going to work. So it's always worth us having a conversation to make sure that we cover all pieces of the puzzle. Now, one other thing that I get questioned quite a bit about is your health savings account, which is an HSA, known as a health savings account. So a lot of times, a lot of the employer plans have a high deductible employer coverage or a high deductible plan, employer plan. So they allow you to contribute to a health savings account. And I've had clients in the past that have decided to continue to work. So they've stayed on their employer plan because it makes sense for them. And they've went out and said, well, I'll just go ahead and get the free Part A, or the Part A that doesn't cost me anything. I'll go ahead and get in the system of Medicare. I won't take the Part B. I'll just take the Part A because that's the one it doesn't cost me anything. But then I'll continue to contribute to my health savings account. Well, here's the deal. If you're on any portion of Medicare and you are the employee, you are the one contributing to your HSA. If you're on any portion of that, you must stop contributing to your HSA. So this is another reason why it makes sense for us to have a conversation, because when we talk, you talk to me and my team, we will tell you, yeah, maybe you should, or maybe you shouldn't be even signing up for the zero cost or the free part of A, because we don't want to hurt you in the long run. Also, let's say that you decide to pick up Part A. Let's say at 65, you're still working and you decide to work until you're 68, for example. And then at 68, you decide to pick up the Part A and B because now you've retired. Medicare backdates the Part A back 6 months, which means you must stop contributing to that HSA 6 months before you retire. Now, I've had a couple clients call me and say, okay, Suzanne, I'm going to go ahead and contribute everything into my HSA before I retire, the full amount. Well, you can't do that. So let's say, for example, that the amount that you're allowed to have is, let's just say $4,200, for example, and you only work and you're only able to contribute for, let's just say, the first 6 months of the year, then you have to take that 4,200 divided by 12 months, because you're only allowed to then contribute 6/12 into that HSA. So that's one deal that I've had a couple of people, unfortunately, they've come to me and they didn't understand that. They went ahead and enrolled into Medicare and they kept contributing. And then they come to me and that's when we find out that they really should not have been doing that. Here's another catch. Let's say that you keep working past 70 and you decide to start drawing Social Security past 70 or past your full retirement age. And even though you're still on the employer plan and you've been contributing to an HSA, if you start drawing Social Security, you're auto-enrolled into Part A. You do not have a choice to opt out if you're drawing Social Security. So you have to be careful. If you start drawing, you're auto-enrolled, which then for sure kicks you out of being able to contribute to that HSA. So the HSA was a big one I wanted to make sure we discussed. Okay, so sometimes ones will come to me and be like, well, Suzanne, I don't even know what Medicare covers. Just explain it to me. So I just break it down into, you have your Medicare Part A, which you can see covers inpatient services. This would be like your inpatient care, being in the hospital, basically paying like room and board in the hospital. Okay. Now, Medicare does not charge you for Part A as long as you've worked for 40 quarters, which in most people it's 10 years. Most of my clients have the 40 quarters for sure. So now Medicare does not cover 100% for Part A services, and we'll get into that here in a second. Medicare Part B is the one that does have the monthly cost. Now, the Medicare Part B is based on your income. And we'll talk about that here in the next slide. Medicare Part B covers your outpatient services, doctor visits, x-rays, therapies, chemotherapy, basically anything where you're going to a facility, having something done, but you're leaving. So, and Medicare covers the outpatient at 80%. Okay, so let's talk about the income. Now, this is the IRMAA that Todd alluded to a minute ago. So basically the way it works is when you enroll into Medicare, the Part B, Social Security pulls your income tax return from 2 years ago. So I'm looking at the 2023 numbers right now because I wanted to give you the most accurate numbers. So 2023, this is what it looks like. If you filed a joint return in 2021, so remember they're going back 2 years. So 2021, a joint return, if you made less as a couple, if you made less than 194,000, then your Part B cost is 164.90. Now, if you're a single, if you make more than 97 or less, it's 164. Same with if you're filing separate. So this is married filing separate. Here's the next one, 194 to 246. Now you're paying a Part B premium of 230.80. Now here's really where I've seen some confusion, because people don't understand how to file their taxes. Okay. So remember, every year, Medicare, Social Security goes back 2 years prior to look at your return. Okay. So let's say that you went and had your taxes done in 2021, and your tax accountant said to you, well, you know what? You're married, but you're going to save taxes by filing separate. So you do a separate tax return, you save a few dollars on your taxes. But in 2023, when they pull your 21 return, here's what I've seen happen, unfortunately. So let's say that each of you make, let's just say $100,000 each. So you're each over that 97,000. Okay. So if you see my screen here, 97,000 to 403,000. Now you're paying $527.50 per person per month. So you may have saved a few bucks on the tax side, but on the Medicare side, is that tax savings really worth it? So let's say both of you just made over 100,000 each. Well, if you would have filed a joint return, you would have been up in this area, the 194 to the 246, and each of you would be paying around 230.80 versus filing separately and falling into this category. So this one is a big deal. The way you file your taxes, you always have to look forward on the Medicare side. So I've even had people at 63 years old come to me and say, well, I had no idea at 65, this is what I was going to have to face. And I've always said, tell your accountant to call me, because it may make sense for you to go back, do an amended return, and even pay the penalties, and you still save money in the long run. Because as you can see, this is a significant difference from the 230 to the 527.50. Okay. Now, we will also talk about the Part D, the drug plan surcharge here in a second. We'll come back to it. Okay, so we really have 3 different scenarios that we can talk about here. So we're going to talk about the SERS, STRS, OPERS, and of course, the ones that do not have those systems, ones that pay directly into the Medicare, or into Social Security, I'm sorry. So the way I kind of explain Medicare is kind of like a piece of Swiss cheese, but I'm a very visual person. So the way I look at this is, well, what does Swiss cheese have? Well, of course it has holes. So that's really how I look at Medicare. We have to make sure that we protect ourselves and fill the holes of the Part A and Part B. So what we're going to do today is talk about the 2 different options. The Medicare supplements, also known as Medigap. Also, we're going to talk about Medicare Advantage. So we're going to break this down here in just a second for you. Okay, so let's talk about Medicare supplements or Medigap. First of all, those 2 words are used interchangeably. So if one of your friends says, well, I have a Medicare supplement, and one says, I have a Medigap, that means the same, that they have the same type of plan. So here's how the Medicare supplement Medigap plans work. Okay, so you go to the doctor, you present your red, white, and blue Medicare card. And as long as it's a Medicare covered event, then Medicare would pay their portion. And then you purchase a Medigap plan through a private insurance company like Anthem, Aetna, Humana, it doesn't matter. They all have them. Okay. So you would purchase a plan through that insurance company, and they would pay second for you. So Medicare pays first, the Medigap, Medicare supplement pays second. Okay. So really, and most of you have probably seen a chart similar to this if you've looked into Medicare at all. These are all of the options of that you can get from an insurance company for a Medicare supplement. Now, I think personally looking at this chart, it's super overwhelming. So what I do is I kind of break it down and say, which plan makes the most sense cost-wise in coverage? Okay. So what I look at is the plan G as in girl. It's the most commonly sold plan now. Now, 5 years ago, it was another plan, but that plan has been discontinued and nobody turning 65 is eligible to even purchase that plan. Okay. Now, if you have older friends, or if you're, in your 70s, 75, whatever, you might have one of those older plans. You got grandfathered into that plan F, but the plan F is no longer available for 65-year-olds coming into Medicare. So now the most commonly sold plan is plan G as in girl. Okay, so let me go back 1 second. So if you look at the plan G, as you can see, it is very comparable to the plan F. It has all the same check marks, with the exception, as you can see this right here, this open unchecked box, so to speak. Okay. Now, basically what that is, that's the Medicare Part B deductible. Okay. So the most commonly sold plan is the G plan. It does not cover the Part B deductible. Okay. The deductible for next year, 2023, is only $226 for the year. So it's not per occurrence, it's an annual deductible. So let me give you an example. So let's say that you have the plan G and you go and you have an x-ray done. You fall, you think you maybe broke your arm, you went to the emergency room, you get an x-ray, you're going to get a bill for up to $226. As long as Medicare pays the 80% and it's a Medicare covered event, which obviously an x-ray would be. So you would pay the first $226. After that, for the rest of the year, as long as it's a Medicare covered event, you would have no other out of pocket. So I do kind of refer this one as kind of like the Cadillac plan, because once you've met that deductible, as long as it's a Medicare covered event, you pretty much have 100% coverage for inpatient or outpatient services. Okay, so what I will tell you is how the plans are rated. Okay, so the plans are rated based on where you live, so your demographic, what company you choose, your age, and your gender. Unfortunately, every year these plans go up in cost. So as you age, you're always going to see a rate increase. Now, what I will tell you also is what is not covered by Medicare supplements are most of your prescription drugs. Now, I do get the question, well, what if I'm in the hospital and I get on, IV treatments, or I get cancer and I have to go into a facility and have chemotherapy? If you are going to a facility and having drugs, given to you through IV, intravenously, so to speak, that falls under the Medicare Part B as in boy. Your maintenance meds fall under Part D as in David, or drugs. Okay. So the way that it works is if you purchase a Medicare supplement, then you must purchase a prescription drug plan. Now that's through a private insurance company. It is not through the federal government. Some people think because it's called Medicare Part D that it's through the federal government, which it's not. It's through a private insurance company. So that's how you would have coverage for your prescription drugs. Now, the way we determine which drug plan is best for you is together, we look at your medications, we find out your dosage, your quantity, the name of the drug, and even what pharmacy you use to find the best plan for you. And together we figure that out and make sure that you're on the right plan. Now, I'm sure many of you have heard the expression of the Medicare donut hole. Once again, I'm a visual person, so I like to show you a donut hole and say, this is how it kind of breaks down on the Medicare side. Okay. So here's the way it works is most of your drug plans have a upfront deductible of $505 that you pay before the insurance kicks in. Not all plans have that deductible. but most do. Now, some, depending on the plan, that deductible might only be applied to certain tiers of medications. So all your medications are broken into a tier 1, 2, 3, 4, 5, 6. Depending on the cost, depends on how high the tier drug goes. Okay. So most plans have this $505 deductible. Okay. After the $505 deductible is reached, you go into what they call the initial coverage phase, which means when you go to the pharmacy, you're going to typically pay a set dollar copay for those medications or a set percentage, depending on the drug. Okay. Now here's where it gets a little, I want to make sure we understand exactly how this works. So the way I kind of explain it is each year Medicare gives you, and I call it like a little kitty of money. So in 2023, Medicare is giving us a kitty of money of about $4,660. Okay, so out here in the world, space, so to speak, you've got $4,660. Let's say you go to the pharmacy and you pay $50 for your drug. So you go in, they tell you, hey, it's $50 for this drug. But the insurance company, let's just use for round numbers, let's say the insurance company pays $450. So really the total cost of that drug is $500. You only paid $50, but the insurance company paid $450. So the total $500 in my example is coming out of that $4,660. So it's not just what you pay, it's the amount that you pay and the amount that the insurance company pays. So if you're taking multiple expensive medications, you could use that $4,660 up in just a short amount of time. That's why it's always important to make sure if there's a cheaper or a generic medication that you try to use that because it keeps you out of the donut hole. Now, once that 4660 is used, then you fall into what they call the coverage gap, or I call it too, and we call it the donut hole. While you're in the donut hole, you now are paying 25% of the total cost of that drug. So now instead of paying $50, you're paying $125 in my example. So if you have multiple prescriptions that's expensive drugs, when you fall into that donut hole, you are seeing that you're in your donut hole, you're spending 25% of the total cost on each one of those drugs, and the price could definitely be astronomically expensive. So you stay, and so a lot of people will say, well, okay, Suzanne, when do I fall out of the donut hole? When do I come out? And a lot of times people think that you take the 7,400, you subtract the 4,660, and you're only in the donut hole the difference. That's not the way it works. Okay. So the way that works is you stay in that hole, the donut hole, until you've paid out of pocket and the total out of pocket has been paid of $7,400. Okay. Now let me explain. While you're in that hole, you're paying 25%. It's being subsidized by the government and by the pharmaceutical company. And you're actually getting credit for 97% of the cost to get you out of that donut hole that goes towards the 7,400. And then you go into catastrophic coverage where you would pay 5% coinsurance or $4.15 copay for generics and $10.35 for brand, or the year starts back over. And then the whole thing starts back over. So I know this is a lot of detail, but I have a lot of clients that hit that hole in August, September, and they're like, oh, Suzanne, my cost just went, amazingly higher. So it always is best for you to review your plans if you're on a drug plan to make sure that you're on the right drug plan to try to keep you out of that hole longer. Now with the Medicare supplement plans, basically the way it works, it piggybacks Medicare. Medicare pays first, the Medicare supplement pays second. If it's a non-Medicare covered event, your Medicare supplement is not going to pay. And that's a question I get quite often is, well, if Medicare won't pay, will my supplement pay? No, it is a piggyback to your Medicare plan. All right, so we're going to kind of change gears here. We're going to talk a little bit about Medicare Advantage. So everything that I've told you we kind of have to say, okay, that's an apple. Now we're going to go to an orange and then we'll compare. Did I see a question?
I was just going to say, Suzanne, I'm just going to make just a quick comment. I don't want to throw you off, but those of you on the call that have the retirement system healthcare and you're Medicare eligible, your supplement or Medigap is the retirement system plan. So when Suzanne mentioned your friends say, I have a Medigap or I have a supplement and they're one and the same. If you're on one of the retirement system healthcare plans, your supplement is the retirement system if you're Medicare eligible. The other thing is the donut hole, while very confusing, the retirement systems do not have that donut hole concept. So just keep that in mind as we go through the presentation. I know some questions have already come in. We'll answer those as we get to the end.
Okay, perfect. All right, so let's talk a little bit about Medicare Advantage. So a lot of times you see the ads come on TV that says, buy this plan for zero cost and you get free dental, free vision, free hearing. Are you on Medicare? That's typically how they start. Well, what they're talking about is a Medicare Advantage plan. Okay, here's how they work, and they work completely different than what we just talked about. So you still must pay the Part B premium. So of course, most people, the Part A is zero cost. So you have to keep your Part A and B through the federal government. Your Part B premium, you must continue to pay. If you're drawing Social Security, once again, that Part B comes out of that Social Security check. All right, so here's kind of a visual of how those plans work together. So those plans really are known as Medicare Part C, as in Charlie. And I've had ones call me and say, okay, well, I read about this Medicare Part C. Do I need to call the government? Do I need to call Medicare and sign up for it? Well, once again, the Medicare Part C are plans administered through an insurance company. Okay. So here's typically how they work. Typically, they have a low to zero monthly cost. So a lot of them, especially in Central Ohio, a lot of them are a zero premium plan. Now you're still paying your Part B, but your zero premium plan. And what they do is they combine together your inpatient, outpatient, and prescription drugs all kind of in one card. Okay. So let's say an insurance company, markets to you and says, here, buy our plan. It's a $0 cost and you're going to get free dental, free vision, free hearing. Well, what we have to look at is with those plans all have networks of providers. So we would have to make sure that your doctors, your hospitals that you want to go to are in those networks that company specifically has contracted with to make sure you get the best rate based on you being in the network. Okay. Now, with those plans, as you can see here, they might offer some additional benefits like dental, vision, hearing. Some even offer like a grocery benefit. One of them this year for 2023 is offering a utility benefit to where it helps you pay your utilities. But what you have to do is stop and say, okay, that's all extras. What does the medical coverage look like? Okay. So with those plans, they are a zero cost or a low premium because some of them do have premiums. They have the network of providers, but they also have a maximum out of pocket. Let me explain how this works. So let's say that you was to be admitted to the hospital. You might, depending on what plan you're enrolled in, you might have to pay $200 or $300 for each night you're there, but it goes towards that maximum out of pocket. Now here, I show you here, it's like $3,500 to a $10,000 max. So I'm even seeing it $10,000, $11,000, depending on the plan. And I'm trying to be vague because I don't know which plan you would be interested in. So $3,500 to $10,000. Now, some people will say, well, Suzanne, is that a deductible that I have to pay before the insurance kicks in? No, it's not a deductible. It's an out-of-pocket maximum, which means you're going to pay co-pays on services rendered, x-rays, CAT scans, MRIs, chemotherapy treatments, just situations like that. All of those co-pays will be applied toward this max out of pocket. Okay. So that's what you got to think about. You have a lower premium, but you got to look at now you have to do a network of providers, and you also have a maximum out of pocket. So you have to make sure you truly understand what your medical liability is in case something would happen to you. So this is really how a Medicare Advantage plan works. Ones will say to me, well, Suzanne, which one is better? And I honestly can't answer that for you. And the reason why I can't is because there's not a cookie cutter that is the best thing for each person. So or the same thing is best for every person. What I do is I take your situation and we say, which one is most likely going to work for your situation, and make sure that you understand all of the rules. Okay, so that's Medicare Advantage. So really now, do you do a Medicare supplement or do you do a Medicare Advantage? Once again, I don't think that there's a right or a wrong. I always like to provide you with the facts and say, here's the rules, here's the options. Now you tell me what you're more interested in, but I have to make sure you understand the rules. So one of the rules that is, a lot of people just don't really understand this rule. And once again, I'm a visual person. So I think of like a ladder. So when I'm thinking of a ladder, at the very top of that ladder, I would say would be like a Medicare supplement, because really you cannot get better coverage than a Medicare supplement is the most comprehensive coverage for the medical. And of course, it's a little more expensive, but you have very good comprehensive coverage. Going down the ladder would be like a Medicare Advantage plan. An Advantage plan is technically a downgrade because less expensive to you, but more out of pocket to you. So here's the big rule that I have to make sure you understand. So if you start with Medicare Advantage, so you say, hey, I'm 65, I'm super healthy, I'll go with Medicare Advantage. And at 75 years old, you call me and you say, well, my doctor just said I need my hip replaced and I'm going to get my knee replaced. I want to now buy better insurance. So if you ever try to climb up the ladder, so you're going from a Medicare Advantage up to a Medicare supplement. If you try to climb up the ladder after you've been on Medicare for more than 12 months, you have to medically qualify and your pre-existing comes into play. So that is very important, because I even have people call me right now because open enrollment starting. That's like, okay, I'm on a Medicare Advantage. My doctor just said I need a knee replacement. Can I go buy the Medicare supplement because I want the better coverage? And I tell them, well, no, we can apply for it. But what's going to happen is the insurance company is going to go out and pull your medical records, and they're going to see, number one, that you don't have any pending pre-existing conditions or pending surgeries before they would even think about submitting approving that Medicare supplement. Now, you can always start at the top with the Medicare supplement, and as you age, if it gets too expensive, you can always downgrade to a Medicare Advantage during the open enrollment season. But going up is a little more challenging after you've been on it for 12 months. That's the rule that I really want to make sure that you understand.
Why you have that thought, it would apply to a question we got. What if I'm in a supplement plan, not an Advantage plan? Can I switch between those? Or does pre-existing conditions come into play also there?
That's a great question. So in most cases, let's say that you're with Anthem and you want to switch over to United Healthcare AARP. Most cases, if you go from one company to another, you have to go through medical underwriting, because the company can say, well, we don't want to take that risk. Once in a great while, a company will come out and say, we're going to run a special and we'll take anybody that's already on like an old plan F, we'll take them into our plan without any pre-existing conditions. I have one carrier right now that's doing that, but it's going to end December 31st and then we won't have it anymore. And in all the years I've been doing this, I've only seen that happen, I think, 2 other times. And you have to be on one of those older plans in order to go to during this specific situation. But if you wanted to go from like plan to like plan, like say a G to a G, no, you're going to have to medically qualify. But that was a great question.
Okay, so let me clarify this, make sure I understand.
Sure.
So I would have to qualify if I started Advantage and wanted to climb up the ladder, I would probably, if I'm in that Advantage plan for 12 months or longer, would have to medically qualify. But if I'm already at the top of the ladder, if I switch companies, there's a great chance that I'll also have to go through medical underwriting.
You got it. You're exactly right. Yep,
Okay.
you're exactly right. Any other questions on that?
Yeah, no, we're good. We can keep going.
Okay.
Thank you.
All right. So really what I try to do is just show you the difference between the Medicare supplement and Medicare Advantage. So really I just put in like a side-by-side chart here. And I said your Medigap or Medicare supplement, basically the way it works is Medicare pays first, and then it's forward to the Medigap or Medicare supplement company. Whereas over here, Medicare Advantage, you still have to pay the Medicare Part B premium. But then what happens is when you go to the facility, the Advantage company is the one that administers your claims. Okay. Premium difference. The premium on the Medigap or Medicare supplements, typically depending on your age, that's why I'm giving a big range, $110 to $120, I'm sorry, to $200 per month. Medicare Advantage, once again, a lot of those here in Central Ohio are a zero cost. The prescription drugs, Medigap and Medicare supplements, you have to purchase that separately. Medicare Advantage has the prescription card built into the plan. Out-of-pocket cost for the Medicare supplement or Medigap. Once again, if you choose the plan G, then you have just that Part B deductible, which once again, that deductible for next year is $226. If you do Medicare Advantage, once again, it's anywhere between $3,400 and I have 67 here, but I'm seeing clear up to 10,000. So that's what you have to look at when you're comparing. What's your true out-of-pocket exposure? Doctors and facilities, Medicare supplement or Medigap, you can basically choose any doctor, any hospital that's in the Medicare, that takes Medicare. So you have a very wide variety of docs and hospitals. Medicare Advantage, if you choose an HMO, you have to stay in the network. A PPO, you can use in-network services or out-of-network services. It's just going to cost you more to go outside. So there you go. You have a little bit difference on your networks depending on a MedSup or a Medicare Advantage. Now, one thing I like to share is any tips and tricks that I have come across. And I actually had a client today call me and she said, hey, my doctor just prescribed me this medication and it's an extended release medication. I went to the pharmacy to pick it up and the pharmacy said that my insurance doesn't cover it. It's going to cost me $187. I think that was 88, something like that. And I said, okay, let's run out to goodrx.com. So we went literally, I was on the phone with her. I Googled goodrx.com, went out, put that medication in, and she could get it at Walmart pharmacy for like $18. So I told her, I said, do not use your Medicare prescription drug card. Go use that coupon, run over to Walmart and get it for 20 or it was like 18 or 20 bucks, something like that, super cheap. So what I guess one of the biggest tips and tricks that I say is don't always go directly off what the insurance is. Like my mom, for example, she has a GoodRx card. She actually went out to GoodRx and signed up. It's free. Signed up for a like a free plastic GoodRx card. And when she goes in the pharmacy, she shows her GoodRx card. She shows her Medicare card or prescription card. It says which one is cheaper. So that's a nice tip. Because my client today called me and she was a little frustrated because it was super expensive, that medication, and she didn't want to go back to the doctor and change it, which I get it. So that was a tip. That's a good tip.
And you don't have to be 65 for that to work either. You could be any prescription that would apply to. Yeah,
I've used it myself. One time we picked up a drug. It was going to be at Giant Eagle like $246. And at Walmart, it was $446. It was a $200 savings. Same drug, just use the coupon at the other pharmacy. Another thing is on your Medicare plans, shop pharmacies because your plan can have a preferred pharmacy and maybe you're choosing to go to a non-preferred pharmacy. So make sure whatever plan you're on, you're going to a preferred pharmacy. Okay, here's another one. Is sometimes there are medications that are a combo medication. Combo medications, maybe it's two different medications put into one pill. sometimes when I see those combo medications are very expensive. But I've had clients, when I see them, I've had clients go back to their doctor and say, okay, this drug is XYZ cost, generally pretty expensive. Can you break it into 2 pills and then it's 2 generic pills? And I just take 2 pills in the morning and 2 pills at night, or however the prescription's written. Then it goes under a single formula of that medication. And a lot of times I see that they can get it much cheaper. Yeah, it's a hassle. You might have to deal with 2 pills instead of 1 pill. But most clients are saying, they'll raise their hand and say, I'll take 2 pills to save some money. So that's a good tip. Taking the brand name medication, the question I always tell my clients is you need to find out if there is a therapeutic equivalent to that medication. Now, sometimes there is and sometimes there's not. But I have had clients that are on like really expensive blood thinners, like Eliquis or Xarelto, like the really expensive ones. Now, yes, you don't have to go get your blood tested every single week, but you also have to be able to afford it. So sometimes they went back to their doctor and the doctor said, yeah, there's no generic for Eliquis or Xarelto, but there is another drug. You just have to jump through some other hoops to get it. And that drug, you have to test your blood, but it's like literally pennies comparatively speaking. So that's a therapeutic equivalent. You just have to work through a different way. I've had other clients come to me and say, okay, I retired. I've got $50,000 in my HSA. What can I do with that money? I love that question. Here's what you can do with that money. You can pay your Part B premiums. A lot of you may be paying the high rate for the Part B because of IRMA. You can reimburse yourself if it's coming out of your Social Security check, or you can just pay it if you're not drawing Social Security for Part B premiums. If you choose a Medicare Advantage, a Part C premium, or the prescription drug premiums, and of course your co-pays on, things like medical co-pays or dentist, eyes, things like that. But a lot of times what I find is people that have a lot of money sitting there, they don't really know where to spend that high amount of money. They reimburse themselves for the Part B of Medicare. So that's a big one. The other thing that I always get a lot of question on is, does my current plan cover me outside of the US? And that is something before every person leaves the US on Medicare, you need to make sure that your plan covers you outside of the US, because some plans give you very limited coverage, even if you do a cruise. So I have clients that say, well, I left the cruise ship in Florida or California and I came back. Well, what happens if you get sick out there? You're now in foreign water, you're in a foreign country. So you definitely want to check on that. Here's another tip that I have here is it's called Medicare Easy Pay. So like, for example, I'll just use my dad because my dad did this. So my dad became a Medicare eligible, but he did not collect Social Security right away. So his Part B premium, once again, you're billed from the federal government on a quarterly cycle. Well, some people don't like that. They just want to get billed every single month, the money come out of their checking account each month. So you can go out to Medicare's website and sign up for the Medicare Easy Pay. Now, it does take about 6 to 8 weeks to get it all set up. But once you get your first bill, you can set it up to come out on a monthly basis until you start drawing, and then it flips over to coming out of your Social Security check. Now, some of you may not even have seen a Medicare card before. This is what it looks like. It's a paper card similar to your Social Security card. You are not allowed to laminate it because there is information embedded in the Medicare card. It is a paper card similar to your Social Security card. I've had some clients, once again, when they turn 65, they're getting so much junk mail that they accidentally pitch this. Make sure you don't pitch it, because then you have to order a new one. But that's what it looks like. Your Medicare number is unique to you. So if you have a husband and wife, you're both going to have different Medicare ID numbers. Okay, so that's pretty much how the Medicare A, B, Medicare supplement, and prescription drug plans work. Now, let me tell you a little bit about how our office works. When a referral is sent over to us, we basically take you through this exact process. We set you down via Zoom or conference call, and we say, these are your options. What do you have through work? We compare your employer plan if you have that. But here's kind of how our office works. A lot of times we get asked, well, how do you guys get paid? So really, we get paid from the insurance company. So if you sign up for Anthem, we're paid from Anthem. If you sign up from Aetna, we're paid from Aetna. But what we did is a while back, my heart said that I was getting so many more calls from my clients saying, Suzanne, can you help us do this? Can you guys help us do this? We're getting older and we really, really need additional help, but we already know we like, love, and trust you guys. Can you do other stuff for us? So what we did is put together what we call an extra care membership. Now, you don't have to join it, but a lot of clients we're finding absolutely love the services. And here's the reason why. If you become an extra care member for $199 per year per person, we give you a lot of extra value added benefits that you don't get with just us going through your Medicare plans with you. So here's what you get out of the $199. You're of course going to get our customer support, your email, our phone support, but we also tell you, we give you a specific prompt to our phone system that when the call rings in, it tells us you're paying for additional benefits. And then what we do is during the open enrollment season, like we're starting right now, we review your Medicare plan for you. Okay. So we'll reach out to you and say, hey, it's open enrollment. If you want us to review your plan, here's the process you need to take. Last year, we saved our clients $494,000. That's almost $500,000. And it wasn't me telling my clients, hey, you need to go change your medications. A lot of times it was, we need to change you from one plan to another plan, or you need to go from this pharmacy to this pharmacy and it'll save you money. I'm actually doing reviews right now. And I just did a review yesterday, and going from plan A to plan B saved him $4,600 for the year. That was amazing to me. So basically what happened is his current plan that he was on decided to take one of his medications and move it from a tier where it was a strict copay, like a $45 copay, up to a tier that was a percentage, 47% of that drug. So me telling him to move from one plan to the next saved him like $4,500. So the open enrollment is a big deal here. We send out emails, text messages, phone calls, making sure that you know we want to review your plan. I also created what we call a billing concierge team. Now that billing concierge team, basically any type of bills you get, whether that be a confusion bill with the doctor's office, or like I had a lady that she was not collecting Social Security and her Part B got canceled because she missed the payment. And it was a snowball effect. They canceled her beds up and all this and that. We was able to get it fixed. I mean, it took my billing concierge team 6 hours on the phone with Social Security, but we got it fixed for that client. So that was invaluable to that client for that. Every month we do a live Q&A, which is basically like a Zoom, similar to this. And we hit really hot topics, like things I keep you up to date on, things that I think that's going to help you as my client, you know, being in retirement and with Medicare. That's all for $199 a year or $19.99 per month. Now, I've had other clients that called me when I sent my survey out and said, what would you guys like us to help you with? They said, hey, I really would like a 24/7 teledoc service because I don't want to go sit in my doctor's office or go to urgent care or whatever, because of, you know, a lot of times it was, you know, back when we had COVID so bad. So what I did is I contracted with a third party company, and I have to charge, you know, $100 more. So it's $299 per year because I have to pay for that services. So if that's something that's not interesting to you, that's fine. The $199 we find for you. But if the teledoc service is good, it's $299. A quick story on the teledoc service. I had someone that her sister-in-law had passed away and she was heading out of town to go to that. In that morning, she woke up and she was really sick. She called the 24-hour teledoc service. He called her in the prescription. It was like, you know, sinus headache. And she picked up the prescription on the way to the funeral, took the medicine on her way. So that was nice for the teledoc service. So that is a little bit about our company. And that is pretty much all I have. Let me stop sharing and I will answer any questions that you guys have.
So let me start by saying thank you, Suzanne. It was a lot of great information. I have a couple questions that I wrote down throughout the presentation, but before I get to that, how would you work with people that already have the pension system healthcare? I know a lot of my clients that I've sent you, they already have STRS or OPERS via benefits. Are you taking a look at those particular plans and suggesting, hey, it makes sense for you to stay on here, but maybe your spouse we do this type of plan for? Or how do you think about it when it comes to the Ohio pension systems and navigating Medicare?
So OPERS, I'll address that one first. With OPERS, if you have over a certain amount of years of service, then you're reimbursed through OPERS, but you have to use a company called Via Benefits.
And that's the subsidy they get per month is what you're talking about.
That's right. So they get, depending on how many years of service they have, maybe they get $200 a month or 300, all depends on the years of service. If you're one of those clients that are OPERS clients, I would love to have you as a client, but it's just not the right thing. So I would tell you, you need to go to OPER or to Via Benefits and let them walk you through the process of what you should do, because I don't want you to lose that stipend. Okay. Now, I have a lot of clients where the retiree that's OPERS goes through Via Benefits, but the spouse that's not OPERS goes through me. So that's kind of how I work with those type of people. Okay. Now, STRS and SERS, I definitely will take a look at those plans with you, because what I find all depends on, once again, the number of years of service that you have. So if you only have, let's just say 8 years or 12 years, you might not be getting that heavy of a reimbursement. And it still might be better for you to go out to the private sector Medicare and buy a Medicare supplement or Medicare Advantage. And what we do is we compare it. So what I tell you, the questions I ask is, what are you currently paying for your insurance and what are your benefits? Because I need to know that information in order for me to look at the comparison and make sure that we're directing you in the right manner.
Okay. Yeah, I know a lot of my clients that are public employees have come to see, and many of them have spouses in the private sector, so they get a lot of advantages. And talking to you, most of the public sector, though, you're finding are staying within those plans for the most part because of the heavy subsidies coming out of the retirement systems.
Mm-hmm. Yeah.
Okay. So I get this question all the time, and no one ever believes me when I answer them this way, because my 7 years at STRS, and now I've been doing this 15 years. So over 20 years, I've been sort of educating people on how these things work. And I don't know nearly as much as you do about Medicare, but I have clients all the time that are still working at 65. They're paying into the pension systems. They're not receiving their pension. They're working at OSU, wherever it may be. And they call me and say, I'm Medicare eligible. What do I do? And I say, and this is the case because the school district or the, let's say, employer is Ohio State, I know it's large enough, you should stick with your employer plan because they're not in a small employer, right? Mm-hmm. And they say, but my family members tell me I'm going to be penalized if I don't sign up today. Right. And I say, no, you won't be penalized. So can you walk us through that window, that, date of birth, the month of, the 3 months before, 3 months after, and how that works if I'm working, but then what do I do and how much time do I have if I stop working after 65 to notify Medicare that I now need it?
Okay, so that's a loaded question. When you come to me and you tell me that you're still working, the first question I ask is, what size group are you on? So if you're in a large employer, which is over 20 employees, I do ask you, before I can advise you, I ask you, is your current plan through work considered Medicare creditable. And a lot of times people look at me like, what's that mean? Well, what that means is the drug portion of that plan creditable? Okay. If it is creditable and you're going to stay on your employer plan, then you don't need to sign up for Part A at all, contrary to what everybody tells you.
Right.
But you have to make sure that that Part D or the drug plan that you're on is creditable to a Medicare plan. Okay.
Which I would imagine most of my clients, that would be the case, most of them.
That I would say most, but what we are seeing is some is not.
Okay.
So if you come to me and that's the first thing we send you back. We're like, you need to go find out, and then we want you to give us proof. So you go to your HR people and say, okay, we need a letter, because they have to give it to you by law, a letter stating that it is a Medicare creditable plan.
Okay.
Okay. We keep that in the file. Okay. Because it could be creditable 1 year and not creditable the next year.
Okay.
So that's very important.
What if I'm 67, let's say?
Mm-hmm.
So I've surpassed the 65, I'm still working, and then I decide in the month of March, I'm going to go ahead and retire. What is the window for me to sign up for Medicare and not be penalized?
So the window is, you cannot have a break in coverage for longer than 63 days.
Okay.
So what I typically tell people is, if you're going to retire, let's say March 1st, get in contact with me in December, January. So March 1st is when your insurance work cancels, you go to Medicare at the same time. So there's not a lapse in coverage, because there are some weird timing and weird rules. So we have to make sure that we don't miss any of that.
Okay. So what happens if I overfund the HSA? You talked a lot about how this can happen, and I actually had a referral come in last week who actually did this. She signed up for Medicare while still working. She shouldn't have, and then learned that she's contributing to an HSA. Now she's trying to figure out how to get that money out of the HSA. What do you do? What are people's choices here?
I mean, your choice is to just take the money back out and pay taxes on it.
Okay.
That's really your choice.
And they work with their HR department or payroll or whoever that is to get that money back out.
Mm-hmm.
Okay.
And just document. That's my, because if you ever get audited, you need to be able to show proof of that.
Yeah. Okay. So changing plans. I know you had mentioned underwriting as people go up and down the ladder, possibly going up, we have underwriting, or changing companies. What about in the Part D drug plan? Any pre-existing conditions underwriting? Or is it, hey, I got underwritten for this plan, it already included Part D, so that whole underwriting process, it's a non-issue with Part D as in drugs?
On Part D, you can change plans every single year regardless of your health.
Okay.
So
great.
that is a very nice feature.
Okay. So what other questions do any of you have? Anybody here on the call have a question? Feel free to unmute yourself and ask questions to Suzanne while we have her on this meeting. Suzanne, this happens a lot when I do my conference call. No one has questions.
Okay, here we
go ahead. Yeah, you can ask.
Okay. We were both employed prior to 1986, and we did not pay into Part A of Medicare through STRS.
Okay.
So it's my understanding that now I am paying, I'm already over age 65. I am paying, where am I? This is
You're
Medicare
enrolled
pay-
in Aetna supplemental
And-
through STRS.
yeah. Okay, I get confused with that. You have Part A, which covers your
See,
hospitalization.
we don't sign up for Part A.
Right. Well, I will tell you the STRS kind of has a unique deal
Yeah.
because with theirs, if you didn't qualify for the zero cost
Yes.
Part A, they allow you to enroll into their plan without having to pay for that.
Okay,
So what I would tell you is don't leave that.
okay,
Because if you went out to the private sector, you would have to have the Part A and Part B in order to get any other insurance, like, with the supplemental Medicare Advantage.
And you'd be paying for part A, right?
Absolutely.
okay. So then with the Aetna, well, with the STRS, let's say, we do not need a Medigap then.
You can't have it. It's an
Okay,
either
all
or
right.
type thing. Yeah.
Okay.
Yeah.
Okay.
So basically, it's a good deal to stay
Yeah,
with STRs.
yeah.
In your situation, for sure. Are you both, you both are teachers retired?
Yes,
Yeah, you for sure, because you're not paying into the Part A.
Yes.
See what I'm
Okay.
saying? So yeah, I would definitely stay where you're at.
okay.
Was there any other questions? Well, I'm sure you'll probably think of something at like 2 a.m. If so.
Real quick, do you want to pull up your contact page again?
yeah.
We're going to send it out to everyone, but I just think that's a great thing to have up there.
Yeah, let me put it up here real fast.
Because as people get questions, I'm sure they're going to love to reach out.
Yeah, actually, the funny thing is when okay, so I'll have to tell myself. So when we go to dinner, obviously you're with your peers typically that talk about, like in my situation right now, my kids are in college. We're talking about college. We're talking about this. We're talking about that. But it's funny because when you go out, what I hear some people talk about is Medicare. They're talking about doctors, insurance, prescription drugs. Once again, if you have friends, family that maybe don't have OPERS, STRS, things like that, feel free to give them my name. So basically what we'll do is we'll just go through the process. Now, I'm not the only advisor in my office. So there's me and there's 2 other advisors right now. I train them all. So I will brag. I feel like they're the top of the line, but there's only one of me. So I had to duplicate myself. So needless to say, when you call in, your friends call in, they may not get me. They might get one of the other advisors, whoever's schedule is, the most flexible. So I just kind of wanted to throw that out there because I do have a great team. I tell my team all the time, they always make me look good because they know more than I do when it comes to some stuff like submitting applications and getting approvals. They're way better than me. But so I just wanted to kind of give you, it's not just me. So you might end up talking to somebody other than myself. Okay. Any other questions?
It looks like Todd's trying to fix his audio. So if anybody has any more questions, you're more than welcome to go ahead and ask them now. Well, if anybody doesn't have any more questions, Suzanne, thank you for
You're very welcome.
sharing this with us. It was very helpful.
You're very welcome. If you guys need anything, feel free to reach out.
Thanks for attending, everyone. Take care.
All right. Have a good night.
You too. Bye.